Hi, everyone. I'm Garden Grove Mayor Steve Jones. This is one of a series of Zoom interviews that we're doing that we want to share with the public. The City of Garden Grove and its network of community partners is dedicated to serving the public by providing access to a full continuum of services and resources. One of the issues at the forefront of this initiative is mental health and the provision of accessible mental health services to Garden Grove residents. I have with me today the CEO of Be Well OC, Marshall Moncrief, who's made it his mission to change the way we approach mental health and create a system of care that provides effective, compassionate care for those facing a mental health crisis. Welcome, Marshall, and thanks for agreeing to join me here today in this format.
Hi, thanks for having me, Mayor. Nice to be with you.
I'll start by saying that I was lucky to get a personal tour last week of your facility there at Be Well OC. It's very impressive. It's very well designed, very well thought out for the various components that it sets out to accomplish, the different sections of the building and the different ways that those different departments interact. Just a very professional, very class act, top-notch facility, and we are honored in Garden Grove that we've created this relationship and that we're going to start doing some services with you. So I'll go ahead and jump right in. The city recently approved a $1.8 million contract with Be Well OC to fund the Be Well Garden Grove Mobile Crisis Response Unit. Can you tell me more about the Mobile Crisis Response Unit, what it entails and who it will serve?
Yeah, thank you, Mayor. The mobile program, just kind of packaging it in its most simple, it's a two-person team, crisis counselors, one of whom we seek to have some EMT kind of medical background, just to be smart enough to know what they're going to run into out in the community. But it's a two-person team that's designed to support law enforcement and to support the community's needs. With mental health services that are more readily available in the community where these challenges emerge. And so it's a complement to the campus that you just described, but also more than that, more than just a complement to the campus. It's really seeking to be highly responsive to the community's needs.
Yeah. This isn't specifically within the context of homelessness, although there will be probably a lot of interaction with our homeless or those at risk of becoming homeless. But this is something that applies to our entire city population. So not necessarily homeless or at risk, but also regular residents. This serves everyone facing any kind of a mental health challenge within their families. In the community. Why is addressing mental health and providing adequate services for those in a mental health crisis so important these days?
Well, I think in the context of your question, you just put it so well that, for many people, the topic of mental health crises comes up, and someone might have in their mind's eye somebody who's struggling with homelessness. And certainly many people who struggle with homelessness do struggle with mental health and substance use challenges. And at the same time, it's so much broader than that. I get phone calls every day of my life, Mayor, on my cell phone from people who are in mental health crisis, looking for help and looking for support. And the vast majority of them are not homeless. The vast majority of the people calling are contributing members of the community. They're well knowledgeable, they're well resourced, and they don't know how to navigate the fragmentation that is our system. And so these are our neighbors, these are our teachers and our nurses and our law enforcement providers and our business owners who also have mental health struggles. And so we need a system that's responsive. When that struggle has reached the point of crisis, we need to be there to alleviate the issue and get them connected to help. No different than we do for stroke and heart attacks and other medical crises. Mental health crises occur, they just do, and it impacts all of us, no matter whether you're housed or unhoused. Yeah.
Maybe in follow-up to that question, just for perspective. So what the city has contracted with you to do is provide this mobile crisis response unit, but at the core, you guys have an amazing facility that you guys have built from scratch and custom designed. Can you maybe just give a very brief overview of the different services that are offered at your facility and how that fits in with the mobile unit coming out and interacting with people and possibly bringing people back to engage with the facilities, with the services provided there at your facility?
Sure. So at the facility we've created, there are 7 different services, from substance use, urgent care, all the way to long-term residential, from psychiatric urgent care to long-term residential. And they function on a continuum. And this was accomplished in a collaborative effort between the county healthcare agency, CalOptima, the Medicaid health plan, and several private hospitals. And so that collaboration has created that suite of services to be available for the whole community, regardless of whether they're a commercially insured person or struggling with homelessness and nothing in their back pocket. So when this mobile program gets up and running, and we may be in the park struggling with somebody who is homeless and has a long-term mental health problem, and that person could be a good candidate for care at this campus. But in the same morning, we may be meeting somebody in the living room of their home who's having maybe a suicidal family member and needs a more intimate intervention within the setting of that home and a connection to a therapist support system outside of that campus. And so this mobile program really wants to be a whatever it takes for whatever the need is in front of us, sometimes interacting with the campus and sometimes interacting with community-based support.
So this series of interviews, as I described in the onset, is the mastermind of Nate Robbins from our Community Economic Development Department. I credit him for sort of bringing this forward in this context. But the goal here is to share with our residents and people looking on some of the various things that Garden Grove does to address homelessness, those at risk of becoming homeless, people facing mental health challenges or crises. So this is to share some stories with them, maybe puts it in a more tangible perspective. Can you think of any real world examples of how the mobile crisis unit might engage with people in Garden Grove going forward? Maybe an example from the past in another city or something or two that you can think of.
Well, absolutely. As we ramp up in preparation to formally launch the program, we're doing some ride-alongs with law enforcement. And one of the ride-alongs recently was to a family. This was a single mother and her 12-year-old son. And they were making frequent calls to law enforcement, who were doing a wonderful job coming to the home and responding with tremendous compassion and trying to help the situation. But they were limited in what they were able to do to assist, and yet would come out multiple times a week on these calls for this 12-year-old boy who was growing in his mental health challenges and some really tough behaviors associated. And in the course of the ride along, the counselor, because they're trained in this way, and because they have the time and bandwidth to intervene maybe more intimately than other services, they were able to take the time and use the skill set to understand that, this boy just lost his father not long ago. And mother is now, dating and starting to do these other activities which are bothersome to the child. And so there's some mental health issues, but also sort of social, emotional issues within the home. And law enforcement was just doing a tremendous job trying to respond to this with the skills and resources they have available, but it wasn't enough to wrap the support necessary for this family to get past the crisis. And so this service, as one example, has the skill set and the bandwidth and the support of PD to go in and wrap that hug of support around the family and get them past the crisis to long-term care. And that's an example.
That's a good one, because like we said, this doesn't just pertain to homeless or people at risk of becoming homeless. That's just a normal family going through sort of normal family challenges and transitions with, with a
That's
father
right.
gone and maybe a new father figure coming into the scene, and just changes like that are, affecting a child's mental health, and perhaps exposure to some support at an early age could help really change the course of his life. So that's wonderful. Maybe a follow-up on that is, I know another thing that was at the forefront of our minds as we were going through this process to award this contract is just from a standpoint of our police department and our police officers interacting with people with mental health issues in the course of their duty on patrol. We've noticed in the past that, when one of our officers on duty has to interact with someone experiencing a mental health crisis, it often takes them off their beat for their entire shift. They have to go sit and camp out at a hospital, watch guard, and so it's disruptive from a lot of standpoints. I mean, obviously from kind of a cost standpoint that we've got, officers off the beat, but also just it's disruptive of the service that those officers are able to provide in terms of public safety. So this really bridges a gap. Is there maybe an example of that, or how the interaction with police will help the efficiency of our police department to be more responsive to crime and the things where they need to focus their energies?
No, absolutely. Mayor Jones, I think you just were hitting on the key things, which is effectiveness, efficiencies, and cost. And so I've spent the last 20 years overseeing mental health in the hospitals of Orange County. And so I have had a front row seat for a long time on the amount of time that we in the hospitals hold up the police department in the emergency rooms with these patients that they're dropping off. And I don't say that with any criticism towards the hospitals. They're doing what we need to do to be safe in that environment and observe transitions of care. And the law enforcement teams have just been tremendous in flowing with that protocol. But it absolutely does remove law enforcement from the job your community has them to do for many hours sitting in the emergency department. In the case of the campus that we created, law enforcement is able to drop off somebody in psychiatric crisis and get out of there in 5 minutes. It's a whole different dynamic. And so
it's a whole different dynamic. Yeah.
And so it frees up law enforcement tremendously. So Mayor, to take that the next step, if in many cases we can relieve law enforcement on the front end and this mobile team can go out and meet the needs of the community member in crisis, now we have further optimized law enforcement and made them available to your community in the way they were intended to be. And so this mobile program really is thinking about what's in the best interest of the community of Garden Grove and what do the residents need for their safety, health, and well-being, and in the best interest of law enforcement, and how do we get them optimized so that they're there to do the really serious police work that you all have hired them to do.
Yeah, exactly. I'm really excited about embarking upon this. I'm, like I said, I'm profoundly impressed at my tour of your facility and just how clean and well designed and well laid out the whole thing is. So we can wrap it up there. I just want to thank you, Marshall, for agreeing to join me in this format so that we can kind of report out, if you will, to our residents about just some of the various things that the city is working on with respect to homelessness, those at risk of becoming homeless, those facing mental health challenges and whatnot. To find out more about the Be Well Garden Grove Mobile Crisis Unit and what Garden Grove is doing to end homelessness, please visit ggcity.org/end homelessness. And with that, thank you very much, Marshall, for joining.
Thank you, Mayor. Thanks very much. It's an honor.
Yeah, and thanks everyone for watching. Be well. Thanks.
Thank you all.